Hello everybody, today is Wednesday, October 28, 2020, and this is the Standing Committee on Health and Social Development. Can I first get a motion to adopt the agenda? Brad Trivers. And I'd like to welcome our committee members, Trish Altez, Brad Trivers, Sonny Gallant is here for Heath McDonald, and Sidney McEwen is here for Jamie Fox, and Hannah Bell is joining us as well. So today we will receive a briefing on the Community Outreach Center. Has been impacted by the pandemic, and we have a couple of guests here today, so I will pass it over to you to introduce yourself and for the record, and then continue on with your presentation. We'll ask questions maybe at the end.
Sure.
Okay, thank you.
Lieutenant Emily Newbury. Good afternoon. Thank you for the invitation to share about the Community Outreach Center. My name, as I said, is Lieutenant Emily Newbury, and I, along with my husband Kyron, are the Salvation Army officers appointed to Charlottetown. In my role, I serve as Corps Officer and Executive Director of Charlottetown Community Church and Homelessness Services. We arrived in beautiful Prince Edward Island in early August of this year, and following our 14-day self-isolation, we hit the ground running, learning about the community and the services the Salvation Army specifically is involved in providing. Currently, the Salvation Army provides direct service through Community and Family Services at our building on Fitzroy, the Bedford McDonald House, and most recently, the Community Outreach Center. Today, I want to take an opportunity to share with you a brief overview of the Community Outreach Center, its purpose, formation, and the clients that we serve so that I can better address for you the impact COVID-19 has made and our plans moving forward into the winter months. I'd also like to introduce Mike McDonald from the Upper Room Hospitality Ministry, who has joined me in today's invitation, and acknowledge his role as one of the members of the Community Outreach Center Working Group, whom we are representing today. The Community Outreach Center is a collaborative space that opened in January of 2020, initially as a 3-month pilot project that has continued through to today. A need was identified by community partners approximately 1 year ago, and within a few weeks, the Outreach Center opened its doors at our first location of 211 Euston Street. The purpose of the Outreach Center is to give streamlined access to government and non-government programs and services, including housing supports, financial supports, counseling supports, cultural supports, employment supports, and safer supplies. The center operates 12 hours a day, 7 days a week, and while providing these supports, is ultimately a safe and warm place for people to go when other options are limited. The approach to the operation of the center is entirely collaborative. It is multi-agency, which gives tremendous opportunity to maximize resources to best support clients. Current partners involved in the working group and service provision at the Community Outreach Center are the Adventure Group, Blooming House, Canadian Mental Health Association, Community Legal Information Association, the John Howard Society, the Mi'kmaq Confederacy of PEI, the Native Council of PEI, Peers Alliance, PEI Council of People with Disabilities, Social Development and Housing, the Upper Room Hospitality Ministry, and the Salvation Army. This group provides oversight and leadership alongside the Salvation Army, who is the main service provider. Salvation Army personnel staff the center daily, and the various community agencies join us there on a rotating schedule to provide in-person supports to the clients accessing the center. Government is the contract holder at this time, but intentional work is being done for a longer-term solution for sustainable funding options. The center is currently serving men and women over the age of 18 years old. The clients may have mental health concerns, addictions, experienced trauma, abusive relationships, they lack employment skills, criminal justice history, and/or are experiencing poverty. No 2 days look alike in the life of the center, as the needs of the clients and the acuity of their situations vary greatly. To date, there have been more than 300 unique individuals that have accessed one or more of the center's services since opening. Typically, the clientele are individuals who are experiencing housing challenges and are either accessing shelter services currently, living precariously, or are homeless. The Outreach Center has not been without its challenges since opening. We serve clients who have complex needs, and they are often facing concurrent personal challenges. We've had trouble finding the right space for the center. Since its inception, the center has had 3 locations: 211 Euston Street, Birchwood School, and now Smith Lodge, which ultimately is still not the ideal space for the center. There has been significant pushback from neighborhoods where the center has been located over this past year, most concerns being of not in my backyard in nature. While many of the complainants have shared their support of the need for the Community Outreach Center, it has always been met with anywhere but here. Funding has also been an area of challenge. While, as mentioned before, government currently holds the contract, we are in need of a more permanent funding model going forward long term. In regards to the COVID-19 pandemic, the center had only been open for a few short months when the COVID-19 pandemic made impact on Prince Edward Island. While most in-person service delivery came to a halt in March of 2020 due to offices closing and staff working from home, we are pleased to share that the Outreach Center remained open 12 hours a day, 7 days a week. The clientele that we serve do not have proper means to engage in remote service delivery, and with so many closures, the majority of clients would have had no daytime options if we had not remained open during this time. This is something we're very happy that we could offer during a crisis such as this. In reality, there was a period of time that the center played more of a role as a warming center or day program, while our partner service providers made appropriate internal plans to safely be available at the center. While we were able to remain open, it was not without its challenges. There was increased pressures on staff and clients as we were seeing more people through our doors, which often amplified the aforementioned complex needs that were seeking to be met. In response to the higher needs, traffic, and location challenges, additional staff were hired to ensure adherence to COVID-19 protocols in our center and to ensure the well-being of all parties involved. This hiring of staff did involve an increase in staffing costs that were not initially anticipated. And so moving forward, we continue to search for a more permanent location for the center that is more suitable to effective service delivery. The working group is committed to exploring governance options for long-term sustainability, including oversight, funding, location, and evaluation. And most importantly, the working group is committed to continuing to offer service to those most in need. As we see the realities of the COVID-19 pandemic continuing into the winter months, the center will remain diligent in adhering to health PEI protocols while maintaining a safe, warm place for individuals to access during these colder months. Thank you.
Great. Thank you for that. Yeah, thanks, Mike. So that was a great presentation, lots there. What I'll do is I'll pass it over to the committee for questions. So I don't know if, Hannah? Great.
Thank you very much for being here today. It's great to see you both. I was talking to Mike before the committee started about the success of this week's food drive for the Upper Food Ministry or Hospitality Ministry. And certainly the connection with the community is, and support from the community is critical. I recognize that the Outreach Centre is something that the community is challenged with, but like there's the dual conversation of we need to do something about this. We have shelters that are not able to be open during the day, so people need somewhere to go. Homelessness and housing insecurity, plus the addiction and mental health crisis has become much more visible. I think in the last few years, it's not that it's not always been here, but it seems to be much more visible, and it's not just in Charlottetown. So I really wanted to set up in the beginning. I know we're talking about what's happening here in Charlottetown, but I would also, Chair, like to come back to talk, if we can, a bit more about the even longer term thing about how do we address outside Charlottetown. But I recognize that right now that's what we're talking about. The other side of it is, so we really need the service, but nobody wants it where they are. Saying that, and I understand how difficult this is to provide this. We're hearing there's a lot of challenges with the outreach centre in terms of its mandate and like you said, the governance piece of it and its current location. So I'd like to ask some follow-up questions on that from your presentation. Can you just clarify how long the outreach centre is open? Like what are the opening hours?
The outreach center is open from 8 a.m. to 8 p.m. 7 days a week.
7 days a week.
Hannah?
Sorry. Sorry, thank you, Chair. It's currently at Smith Lodge.
That's correct.
What's the capacity at Smith Lodge for the centre?
We currently comfortably can fit about 15 to 16 people with COVID-19 protocols. So while we are seeing 35 to 40 people per day, it can't all be at the same time given the challenges of the space.
Hannah?
So where one of the functions, particularly to come into sort of more difficult weather, is effectively a warming centre, in that right in the summer, some of your clients may be okay to be in the park or, on the street effectively. How are you going to be able to deal with that? This is I see as a real challenge, because effectively you can't fit the people in that need the service. Has there been any conversation with your working group? Is it a working group that is your advisory group about that urgency? Because November is sort of the tip point, that I see.
We certainly feel the urgency to find a new appropriate location. Active work is being done to find that location. A realtor has been engaged. As we have seen opportunities within the community, we're jumping at those to go take a look. Ultimately, zoning has been a concern. While a space may be available, it's not zoned correctly, or the space cannot be retrofitted how we need to, because we want to not only provide a warming space, but opportunity for showers, washroom facilities, laundry facilities, etc.
Chair?
Hannah?
Have you had any support or ongoing support from the City of Charlottetown in terms of the planning, zoning, and or from the province, particularly Department of Communities, on either of those challenges?
Just recently, a meeting was first held with the City of Charlottetown and a few other key community members, including Sergeant Watts, and this was an opportunity to express especially the need for a new location. So other departments have been engaged, and the City of Charlottetown is now is actively engaged in assisting with this search.
Hannah?
That's good to hear, because obviously if it isn't a priority for the city, it absolutely should be. We want to be able to get ahead of this, because frankly it's not like this is a surprise. This is the third year that I've been having this conversation about the need for a consistent, and I think safe is a really important part of this word. Unfortunately, we are hearing, because of the capacity challenges, that the trickle down on that is that people are not conducting in safe behaviour, and that as a consequence that space itself may not feel safe, and that is the opposite of what we want to see. So it's a real concern from multiple spaces, because obviously that also accelerates the conversation around, see, we told you it wasn't, and that's a real concern certainly from our side, what we're hearing, and I'm speaking sort of on a general basis, sort of getting feedback from the community. You talked about having staff on hand and you're hiring and so on. How many staff do you have on hand if you're having about 15 or so people cycling through?
Currently, we are having a 3-person staff model, so always 3 staff available at Smith Lodge.
Tana?
Thank you, Chair. When hiring staff, what qualifications do you require for vulnerable populations?
We do post this job as a residential worker, so we would want candidates who have a background in social services or addictions programs. We have connected with Holland College, and that is actively being pursued. to find more candidates for these positions. Ultimately, it is difficult to find the suitable candidates to fill these roles. It is a difficult population to work with, ultimately. And so sometimes the hiring is not so hard, it's the retention. Feeling overwhelmed and just not quite sure necessarily what to expect. And that can be quite shocking when working with this population.
Hannah?
Thank you, Chair. How do you manage the safety of your staff and your clients on a day-to-day?
So that is partly why we have the 3-person model. We originally were staffing the center at a 2-person model. Given the realities of the space that we're in, Smith Lodge is an older building. It is not a wide open space. We recognized that for the safety of both clients and staff, we needed an additional person available on site. For their own personal development, we do have mental health first aid and non-crisis intervention programs that we invite our staff to be a part of, and we would like for them to come trained with those when we hire, but often we have to provide that training for them.
Hannah?
Sure, thank you. So you're open 8 to 8, and you've got more people needing the service than can. So how do you have a limit on how long people can stay, or like how do you measure that someone is getting into the service? If they pop in for 5 minutes, are they counted? If they're there all day, are they counted differently? Like, are you tracking that part of it?
We are. So initially we were counting who was coming through the door, but recognizing that someone may come in at 8 o'clock and then go out for the day, come back at 4 p.m. And we recognized that our numbers weren't necessarily accurate when we did it that way. So now, in addition to assist with contact tracing, we have people signing in, and then we just acknowledge when they've returned for the day, that sort of thing. To this point, we have not had to remove anyone because they've been in there for too long, but we do recognize that that is a challenge we may face coming into these winter months, knowing that people will want refuge from the cold weather. So it is something we're needing to address.
Hannah?
I know this predates you coming in, because this is and it's welcome. It's lovely to have you here. Nothing like picking the best time to come and take something on. I'm hoping that there's data sort of from before that, though, because you spoke about it being at the other locations. I went to the opening of at Euston, and obviously Birchwood's in my district. So this has been a major part of my constituency space as well. And I know that when they first opened Euston Street, it was overwhelming. There were 75 people, I think, through the first 2 days. It was, so do you have data that shows sort of, I guess, 2 parts? One is, has that usage sort of changed over the time? And do you have an idea of how many unique individuals you see?
I can confirm that to date, we have had 300 unique individuals access one or more services. As for data, is that something, Mike, you would be able to?
I really don't have access to that, but I'm sure we could bring that to you.
Hannah?
Thank you, Chair. And it's, it's more just about capacity. I think we're pretty clear that 12 to 15 is definitely not enough. Ballparking 30 may not be enough either. Ideally, if we find a space that needs to allow for flexibility in capacity, but there's a lot of other needs you mentioned there as well. When you talk about safety and security, an open plan room is safer than an older building with lots of small rooms, but you also do want some things like washrooms that are also safe for usage. I know in Euston there was an issue because it was out of line of sight. There were some challenges with the washroom there, for example, which makes it much more difficult to find somewhere. Who is going to be able to pay? Like, is this a conversation that you're having with the Department of Social Development and Housing about the cost of a lease and potentially renovations to a space, should we find one?
Yes, that's something that Social Housing and Development is helping us with.
Hannah?
Thank you. A huge concern again, cost. I know how long it took for us to find a place for Gifts for the Heart. That was a long time. So, just to get that kind of space. Perhaps, Chair, if I just ask one more and then I can circle back. You mentioned about the governance structure. So you've got a working group. Are they regularly engaged in the the kind of this kind of stuff, like the day-to-day about the delivery and so on, or is that something that is more of an ad hoc basis?
Do you want to answer that one?
Speak to that. We're all involved in different ways. Certainly, for instance, we're talking about governance all the time, and how do we best, kind of make this a mature, viable organization. We're meeting every 3 to 4 weeks and talking about issues. We're not all there day to day on the ground like the staff are. Certainly that's the role of the Salvation Army, but yes, we're all involved, and we hear all of those concerns that you're asking about, and we have the same concerns. I know there's more than 15 people that need shelter at any given time in Charlottetown. It's extremely difficult to find that type of space in this city. The more that we go on, 211 Euston Street was far from perfect, but at least it was an open space. Really, it was divided by furniture. It gave us some things. The Birchwood was very, institutional and too big, and it was great for social distancing and that type of thing. But to have that comfortable feeling and making sure that people felt welcome and wanting to be there was difficult. And Smith Lodge being that choppy type of building, it really shows us, I guess, what we do need and what we do want for those individuals.
Perfect. Trish?
Thank you, Chair, and thank you for being here today. You mentioned that this is a collaborative space, and you listed several incredible organizations that are involved with this outreach center. I was wondering if you could elaborate a bit on how that collaboration works.
So on top of being represented in the working group as an organization, the model is that while Salvation Army personnel staff in the sense of direct supports, it's a rotating schedule of sorts that on certain days of the week, certain organizations are there and available. The intention would be that the Salvation Army would triage as clients come in and can then help to connect the clients to the supports that they feel they're best suited for. In turn, if a service provider is there and is meeting with one of their clients and realizes there is a need from another service provider. If there's another service provider that could better care for or assist with those needs, then it's a collaborative referral program within the building, and gives an opportunity for sort of a one-stop shop, for lack of a better term. They know that they can go to the outreach center on this specific day and meet with this specific service provider, and the next day be able to meet with another.
Trish?
Thank you, Chair. And are there any sort of structured workshops or activities that take place at the outreach center?
There are. That's something that is certainly picking up more. As I mentioned in the presentation, there is a reality that when COVID made impact, certain service providers were unable to come to the building just because of internal policies and figuring out what could be done safely. Now that we're living with COVID and not necessarily just managing crisis, more opportunities are being available. So we do have workshops that happen at the center, or they're advertised at the center so that they know what's going on perhaps at another service provider and they can then attend.
Trish?
Thank you, Chair. So is there any sort of a framework for service at the outreach center, or an outline of what sort of your mandate and goals are? Do you have all of that in place?
Do you want to speak to that one, Mike?
We're still growing. We still have a lot of work to do. Our doors opened towards the end of January, and we were really kind of honestly rushed into it, that we saw that immediate need. And a lot of our work did go on pause because of COVID. And really, like Emily had stated earlier, it was really a warming center for people to go. It was a spot to get some food. It was really a spot to, get somebody off the street. So now, we're really working on our goals and what we need to do to help individuals, each of our members, what they can do to help individuals and what everybody's role is. So it is something that, it's a constant evolving thing that we're working on.
Trish?
Thank you. And has there been any sort of an evaluation or something that has been ongoing during this pilot? I think you mentioned it was originally intended to be 3 months and has continued on. Has there been any, just any evaluation that's happened throughout this?
Yes, just recently, the working group gathered again for an opportunity to reevaluate what the initial goals and hopes were for the center, acknowledge what things perhaps had not been happening yet, what had gone off course, what could we course correct, what needs to be implemented. That's a very recent meeting, and so we do have some new points that we would like to implement at the center because of that. Recognizing that the model did change because of COVID, and now redirecting ourselves to offer and deliver the service that it was initially intended to be.
Trish?
Yeah, no, that's really great to hear. And so this, the meeting that you had recently, is this something that was minuted? Not that we need to have record of that here, but just to make sure that all organizations are, if they can't directly be at a meeting, that they all have a sense of how this is developing, because it's going to be so critical to what this outreach center is going to look like moving forward, right?
Yes, it was minuted and documented.
Just one more thing,
Yeah.
Chair, if I could. As my colleague Hannah had mentioned, this is the type of service that's needed. It's great to have it in Charlottetown, but we have challenges across the island with homelessness and poverty, and people who need to access a route to access services safely, and a safe space to go to. Particularly in Summerside, I would say it would be a great benefit to have a center where people could go, where they could get information, and they could be safe and just a drop-in space. Do you see that as a possibility for the future to expand this type of service to other areas of the island?
Personally, I can only speak to Charlottetown, given that that's my jurisdiction from the Salvation Army, but certainly I believe is something that could be directed to the province.
Great.
Thank you, that's all for now.
Great. So I'll just ask a few, and then Hannah will come back, and we'll kind of move forward from that. You'd mentioned, we talked about the pilot program in the 3 months, and I guess data becomes critically important, for your own organization, and for us to really get a look at what's happening. Was it the Department of Social Development and Housing that was going to correlate the data for your program? Do you know?
That is my understanding.
Okay.
Yes.
So then you have talked to them, and should we expect, did they mention to you, are they going to come out with a report about how things are working?
I have not necessarily had confirmation of that, but I would expect that going forward, given that we need a more long-term sustainable model, that is something that will need to be prepared no matter what.
Yeah. You had mentioned there was, you learn a lot at the beginning, and this is so important, but you had mentioned some course corrections or some type of things that you might have learned that you're getting better with as we head into maybe more of a winter season. Last year it started in January. Boom, you had to learn on the fly. What did you learn from the first time through that you're going to make changes over this winter?
Mike, is that something you can speak to?
Well, like you said, we were right in the middle of winter. I think the biggest thing is having access for people, and it kind of goes back to Hannah's question that we can only have 15 people in there at one time. So for us right now, that's probably our biggest concern and the biggest thing that we're looking towards in space. That we need, we do need to find a space that, we can have 40 or 50 people in there at one time safely. So, for me, that's the biggest thing, as long as we still have washroom, shower, washer, dryer, all those facilities. The other thing is that it's important for us to remain open, for that 12-hour period. So if an individual does leave a shelter, they have a place to go to until they're able to return. At the same time, making sure services are provided, people feel welcomed, people feel safe, people are comfortable. To me, it always comes back to that welcome, that you feel good walking through those doors, and it's a comfortable spot to be.
And Mike, you've done an incredible job taking care and working so diligently over the last, decade with your role. And you would see a lot of people. I guess my question is going to be around outreach. So you'd see a lot of people. What are a couple, without saying anybody's names, like success stories that this program has provided to people that you've maybe outreached and then gotten into this along the way?
Well, a couple of the people, and you're right, I won't mention names, but just some of the biggest things that I see is how people feel about themselves and how they interact with other individuals, and they just, to me, seem to be much happier people. They, I would say, maybe relied on services like ours much more than they do now, and they're accessing other things, and they just, personally, I just see a lot of difference, and I'm thinking about a half a dozen people right off at the top of my head that I've seen a real impact on those people and just how they hold themselves every day.
Good, thanks, great answer. Emily, and it's something that ever since you got here, and when you said that you came from away, I've wanted to ask you about, because you have a rare perspective. We're all islanders, and we know that there's an issue, but coming in from outside of Prince Edward Island to get into such an important role, what was some things that were striking to you? Like, was the need striking? And when you thought about Charlottetown, what are some of the things that you can put a snapshot on?
Absolutely. So on a personal note, my grandfather is an islander, and so I spent a lot of my summers coming back here to visit, but certainly in smaller communities. And so Charlottetown, being, the big city, was not something I had been exposed to really before. And so I really was surprised by the need. With operating, for example, the Bedford McDonald House, realizing it is consistently full every night, to overflowing at times, and it really was surprising to me. But I see just the opportunity that the Salvation Army has and other service providers have to assist this vulnerable population in Charlottetown.
Yeah, and it's you can see that. So when Mike Redmond was here last year, I'm not sure the date, he indicated that housing was one of the most common issues being identified, and we've had social development and housing in, and some of the modeling is moving towards more almost a rent voucher model, where people are getting rent vouchers versus. But my question to you is do we need more housing in down? Is housing an issue? Is that still the primary issue that you see, or is there other things?
I would say it certainly is an issue, affordable housing specifically. I know in just recent days we do have people who are currently accessing the Bedford McDonald House who are holding full-time jobs and employment, but the concern is their housing. But also recognizing that there are a number of people in this population who would have difficulty being housed at this time without proper supports and opportunity to develop those skills to be able to live independently in their own unit or whatever that looks like.
Perfect. Okay, I'll pass the floor on to Hannah and then maybe ask a couple questions at the end. Oh, and then Sunny. I don't know who wants to go first. I've messed this up.
Right, Sunny, did you want to go?
Sure.
Okay, so there was some money given from the government, around $50,000, is that correct? Back in April. Has that been exhausted?
My understanding is yes, we are, all funds that have been coming through have been flowing right through into staffing and resourcing of the center.
Sunny?
Has there been any allocation of new funds to help out?
We have been pursuing grants from other organizations to assist with the funding, but ultimately, yes, the government has been assisting with the funding of that.
Is there an appetite maybe to sit down and talk about multi-year funding rather than just short-term funding?
There is certainly conversation around multi-year funding. The reality that it did start as the 3-month pilot, which then continued by necessity. It was well received, but also the realities of COVID-19. We've sort of been operating as we can, but conversation is happening about multi-year funding and moving forward.
Sunny?
Thank you, Chair. And as far as your safety equipment, like your PPEs and all that sort of stuff, is that being supplied to you, or?
We have had to purchase in the past some of the PPE, but there has also been donation of that.
Thank you very much
Sunny?
for all you do. Thank you, Chair.
Great. Hannah?
Thank you, Chair. We're really clear, this was never going to be a 3-month pilot. That, you know, there was never going to be a magic thing that was going to solve this. It was more a matter of admitting out loud that this was a thing that we needed. So, to my colleague's point, you know, a bit of money every now and then is not the answer. This needs to be funded and recognized as part of our social security, our social safety net, to address the needs of a really vulnerable population. And it fits into a bunch of other things that we know we need too, but the idea that this would be a pilot is perhaps naive. so I can certainly see that stepping out with multi-year funding when we're not quite sure where it's going to be yet could be a challenge, but in the meantime, the idea that you may be worrying about can you pay your staff is as always, a huge concern too. So even in the interim, that needs to be a recommendation that there is interim support for whatever we're providing, because what we're providing is better than nothing. Saying that, I still have some questions about what we're doing now. And there's a couple of quick things. Is Smith Lodge, the current location, accessible for people with disabilities?
It does have its limitations, absolutely. It would not be an ideal location to consider accessible.
Hannah?
Thank you, Chair. I know that was an issue with the first location, and it probably resulted in the working group being expanded to ensure that representation was there. I have a difficult question, and I would like to be clear that I'm asking this question as a representative of the committee, but also because this is something I've heard from the community, and it's about the role of the Salvation Army in its equitable provision of services, given that there has been certainly perception, if not necessarily demonstration, that there are barriers from the Salvation Army to provision of services for people who are from the LGBTQ community. It's certainly been something that we've heard about as anecdotal. There is significant concern in the community that remains the case here. Could you speak to how you provide services to those that need them, and whether that does include services for those who are in the queer community?
Absolutely. So as a Salvation Army, we are committed to serve without discrimination, and that is something that we especially are committed to here in Charlottetown with myself and my husband Kyron, looking after the operations here. That is something that we are instilling in our staff and those who come in contact with us. I think in terms of the outreach center, that's something that we are committed to, serving without discrimination. And I think even the partnership with having Peers Alliance as part of this working group and us working together is evidence that we certainly have, no intention of not serving. We want everyone to feel welcome and available to access service at the outreach center.
Hannah?
Thank you. I appreciate that. I think seeing the working group representation is a big piece. We unfortunately often see with government in particular, that, you know, an assembly of all the right people at the table, but not necessarily that following through in action. So when we speak about you needing a new space, ensuring that space is accessible is part of, is part of the reason why you need the Council of Disabilities on there. And the same reason that for Peers Alliance or other groups, the Mi'kmaq Confederacy is another one. Sometimes we need to be more clear in our action. Is that something that you would consider having, a code of conduct or sort of a statement of values? And then how would you show that in the way that you design and deliver your programs?
Absolutely. So as Salvation Army employees, which all the residential workers and others who work at the center are, we do have an internal code of conduct that does say that we serve without discrimination. Recognizing, though, that that's something people sign when they have a whole bunch of paperwork as they onboard for a new position. So it's certainly something that we have an upcoming staff meeting. We will be just, addressing norms of the organization and also the norms of the outreach center. So something that I think especially just takes constant communication, reminders, opportunity for it to be posted, say in the staff room, recognition that these are our values and the way that we operate here at this center.
Thank you, Chair. And again, that kind of action to, word to action piece is, that's an additional layer of complexity for a vulnerable population. You have a vulnerable population who may be from housing insecurity, you have that on top of that potentially mental health or addictions or any of those other potential trauma pieces informed, and then you layer on top of that being in a space where you may not be safe because of your gender identity. And so that can include things like safe washroom accessibility, that you're in a space where you can feel that you're safe to go and use the washroom or have a shower. In the same way that we would expect an accessible space to have the doors wide enough to accommodate a wheelchair or a walker. And so those are some of those pieces where, what has been really useful in other spaces is bringing that lens, that, you look at it through the lens of inclusivity, and having these partners at the table is one of the ways that they can be really effective partners, is by asking them to provide their expertise when it comes to developing a floor plan or a safety protocol, or even how you communicate, in the space. And so, I think that's one of the ways to address that ongoing discussion and take it out from being a rumble in the community into that bright light. I really appreciate your candor in the response. Chair, if I have just another question to finish up this. Thank you. You had mentioned about the employees. These are you and their staff are employees of the Salvation Army. Does the Community Outreach Centre exist as its own entity? Is it an organisation in its own right, a non-profit organisation or something, so that it has its own kind of responsibility and governance?
Not yet. And that's what we're working towards.
Right.
Certainly the Salvation Army has stepped up to operate it, but we do need to look at governance and, where we're going to be in a couple of years and how it's going to be governed, how it's going to be staffed, best practices, how we're going to fund it. So those are things that we are looking at now. We do have a couple options on the table, and it's really the working group that has to discuss that and see which direction we want to go, and then really get into how are we going to implement that.
Anna?
Thank you, and that's good to hear. Partly because of the independence of it brings challenges, but it also brings that independence, and there's always risk with that. There's a really immediate reason to ask, and it may well be on your radar, but CMHC has just announced the Rapid Housing Initiative, which is a significant amount of funds available specifically to address immediate housing pressures. And that can include program delivery as well as a delivery of housing. So I think it's something like the Fitzroy Centre, where it has the program delivery in the front and the apartments in the back, but it's specifically to do rapid provision through things like renovation or reclamation of other spaces, and that may well be a route. You may not as a standing existing organisation, but through partners who you may be able to partner with to apply. So I'm seeing that that's probably on your radar, but the deadline is December 31st. It's really quick, so, and I'm already getting a bunch of emails about it, so I wanted to make sure that that was on your radar, because that could be a route to addressing some of that kind of project cost that we're talking about with the centre.
So we are very aware of that program and many others, and maybe working with our partners more on how to access that, because when we do get in a governance, we want to make sure we do it the right way the first time and take our time doing that, for sure.
Anna?
Thank you. Regarding the people that are able to come in and use your services, if somebody is using or is currently under the influence of a substance, are they allowed to use the services at the outreach centre?
They are. We are a behavior-based model, meaning that they can be under the influence as long as behavior is along the lines of what we have made expectation for the center.
Yeah.
And you mentioned safe services earlier in your listings. Are you providing a safe space for usage, or is that not allowed on the premises?
We do not have usage on the premises, but we have access to the Narcan and naloxone kits, opportunity to receive assistance, but not to partake on the property.
Anna?
Thank you. Thank you for that. It's an important distinction. It's one of the things that also make people feel not safe, and certainly, as again I asked earlier about the safety of your staff, because, unfortunately with people who are using or under the influence at the time, your likelihood of potentially altercation, for example, is higher, which again puts your other clients and yourself at risk. But there is nowhere else to go, is our recurring theme. Are there any other criteria that you use to determine who can and can't access services? I know Bedford MacDonald House in the past, and I think we spoke to Mike Redmond about this, was you sometimes have clients who basically have exhausted all their opportunities and they just, they've hit the no, you can't come back phase. Is that something that happens at the outreach centre?
At the outreach center, we don't have a specific criteria for availing of the services. It is open to everyone. As I mentioned before, it often is people who are experiencing homelessness or similar situations. We don't necessarily ban people from the property, but acknowledging that if there is a safety risk, we do often have a cool down period and ask that they not access the service for just, a period of time to ensure safety. That's our main concern. But ultimately, we want it to be a place for everyone. And if someone's safety is at risk, then we do have to address those. But as I said, it's behavior based and not a lifelong situation, but rather something to be readdressed.
Anna?
There's obviously a relationship between Bedford MacDonald House and the outreach centre just by the fact of the same management team. Do you see more of a then as a lean to the male clientele as a result, or is there, because I know Blooming House is also full every night, and there's a significant need, but women who are experiencing housing insecurity are often not as visible, and they're also not as safe. So I'm just wondering if just because of that relationship there, are you seeing that kind of impact in the people who are using the outreach centre?
We certainly are seeing higher numbers of males accessing the center, but the Blooming House women do also access, and anytime I've been in there personally, there has been a mix of both, but certainly more males accessing.
I'm good for now. Thank you, Chair.
We'll go Trish, then Brad.
Thank you, Chair. So you described the model as a behavior-based model or approach, and that you have a certain set of or acceptable behaviors, things that are acceptable, things that are not. How do you communicate that to clients so that they know what to expect and what is acceptable behavior?
We do have rules posted, and it's something that our staff are reminding people of before things are at a crisis moment, expressing concern and saying maybe we need to reevaluate this moment and moving forward. But ultimately, those accessing the center are made aware of what the expectations are upon their arrival.
Trish?
Okay, thanks. So just to clarify, so I understand the process. So the rules are posted, and when a new client comes in, that's something that you go over with them, just so everybody's on the same page.
Absolutely, yes.
Just one more thing. So as you are working to, develop your governance structures and a clear mandate and framework for service, obviously that's, you said you want to take the time to do that right. I don't know if you have any expected timelines for completion of that work at this point, but I would definitely, love if it was possible to have you come back to the committee. I don't know how others feel about that, but because this is such a new and developing service, I think there's a lot will. I don't know if a lot will change, but there's a lot to learn here. And as I mentioned before, I would love to see a service like this be accessible in other areas of the island. So there's a real learning opportunity here, and I think you've only just sort of just the tip of the iceberg of what this is going to develop into. And there's a lot for us to learn once those things are developed. So that's all. Thank you, Chair.
Brad?
Thanks, Chair, and of course, thank you for your presentation. It's very informative, and I'm learning a lot. One thing I wanted to just clarify 100% is your funding right now. So obviously, the provincial government through social development and housing is very, very much involved. I think the United Way is also involved. Is that right? And of course, the Salvation Army. Maybe I should just let you answer the question. Yeah.
So as I've said, I am fairly new, so still wrapping my head around everything. Yes, the majority of the funding is coming from the provincial government. The Salvation Army has put money as well into this, and for making up for shortfalls, I suppose, is where we are seeking grants and pursuing other community partners for money to assist in the continuing of service there.
Brad?
So obviously, one of your challenges you've highlighted is the building itself, right? That's the major challenge. And right now, I mean, that building, like the rent for it, is that something that, basically the provincial government has said will provide you with the building so you can provide the service, or how does that work?
Currently, the building is owned by the province, so they are ultimately the landlord, and we provide the service in the space.
Brad?
The other thing is, I just wanted to clarify again whether it is accessible. I was just looking at pe.211.ca, and it says it is accessible, wheelchair accessible, but I thought it sounded like maybe it wasn't. I just wanted to clarify that.
It is accessible on the main floor. I wouldn't say necessarily up to great standards at the moment. It does have a number of narrow hallways, short corners to get around, that sort of thing. It does have an elevator inside for access to the upstairs, but currently the outreach center is not using the upstairs of the building.
Brad?
The other question I had was really about, the people using the center, and how many you use it, for prolonged periods of time, and how many, and I think Mike had talked about it, are you able to help kind of, this is just a temporary thing, it's more of an emergency situation, but through, especially with your partnerships with other organizations, you're able to, maybe get them a mobile rental voucher so they can go and they find a place to live and they don't have to use the outreach center anymore. So like what sort of turnover do you have in your clients? If maybe that's not the best way to phrase the question, but yeah.
I would say from a service provision side, certainly there have been clients who've been able to be connected with housing, for example, connecting with the housing navigator, securing housing. I would say, though, that over these months through COVID, there has been loneliness and isolation, and so turnover, perhaps they're able to move forward in their situation, but I would say they're coming back to the center also to have community and other people to be around and not isolated. So from that perspective, I'm sure there are people who started coming to the center in January who are no longer accessing, and others who are doing, they have made progress and move forward, but are still accessing the center for a sense of community and being around other people.
Brad?
Is that something that you could, provide stats on, like based over the time you've been open, how many, what percentage of people basically are still coming over that time period, and what percent of people have, not returned, kind of thing?
I think that's something we can certainly look into. I think that's a valuable number to look at.
Brad?
So, in terms of what you were talking about, and this idea, loneliness and social interaction, I know that, for example, the provincial libraries provide a spot for people to go for that same sort of idea. It's a place to go during the day that's safe, and there is some interaction, and of course, we're working to open them up as much as possible. Do you think that when we're open fully with our libraries, that'll help, take some pressure off you for that? Or is it something, have you been working with the libraries group at all? Or do you think there's an opportunity there more than what we're doing right now?
Is that something you want to speak to?
I could say we haven't been working with the libraries, and I'm not sure how much it could alleviate. I'm sure it would, alleviate some. I would say that we're open to working with any partner out there that could benefit the individuals that are using the service. So if it's a library or any other service that they have value to individuals.
Brad?
Good, thank you, Jeff.
Just a couple of questions in closing. So, if people wanted to make a donation, would they just make it to the Salvation Army? Is that?
They would, yes. They'd
Yeah.
make it, I think that would be the easiest way, most straightforward, make it to the Salvation Army, and it would be directed to the Outreach Center specifically.
And is a portion of that, the kettle campaign, and it's great, I mean, all Islanders love it, but is a portion of that go to the Outreach Center, or is that,
The funds that come in from the kettle campaign are used locally, and that is a local initiative of the Salvation Army.
Okay, good, that's what I was just trying to
Yeah.
maybe get at, because I think that's good news. And then, so, if you're looking at, you've had a pilot program, you're there, how much do you, if you were setting goals, how much would you want to set a goal for to fundraise for on an annual basis? How much? I'm just trying to get a sense of finances here in the next little bit.
I don't know that I have an accurate answer for that one
Yeah.
at the moment.
Yeah. How much ideally per year would you want to see the provincial government participate and participate in funding?
I don't know that I have an accurate answer for that one either, unfortunately.
Yeah, I'm just trying to make sure that we kind of we figure out and talk a little bit about funding, because part of the committee's responsibilities when we do the report to the legislature,
Absolutely.
we want to make sure that we include
Certainly.
various things in that report, or that recommendations moving forward. So I'll pass it over to Hannah. Yeah.
Yeah, and to follow on from the chair's remarks, I mean, what we're hearing from you is that you have a space which is not suitable or big enough now, let alone in the winter, and that you also have operational overhead to appropriately and safely staff, which on a larger space would be more than what you have now, and that this is a critical piece of the social safety net. I mean, I appreciate my colleague's point about other potential services, but when the shelters that we have close at 8 o'clock in the morning and you have to be out and you're not allowed back till 8 p.m., there's only so much time that you're allowed to spend in coffee shops and libraries and other places before you get kicked out. And that was always the reality. Additional to that, obviously, we are talking about some clients, not all, but some who, like you said, there's some clients who are working and have full-time jobs, and they're just literally housing insecure. But there are other clients who are extremely unwell and need a lot of help and are not actually safe to be around in the general public. And you know, I think we need to be really careful that we're talking about a really broad spectrum of people, and that there aren't actually really simple answers for this. That the community centre, the community outreach space is the safest safe space we've got right now, that at least sort of recognises that who the clients are that you're dealing with. I think the other thing with your working group partners is these are all, you know, really passionate, committed partners. None of them have any money either. Like, these are all partners that are on the list to also get funding from government. So there is, it's very difficult not to be angry that we have to fundraise continually to help people who could die. And that's what we're talking about here. You know, I appreciate us talking about success stories, but we're also talking about keeping people from dying. This is the third year in a row I've sat in this house and talked about that I don't want this to be the winter where our headline is that somebody froze to death. So I think this has to be a priority, and it has to be a priority not as a nice to do project on the side or a, you know, thank you so much, here's an extra little donation. This has to be about a commitment to recognizing that this is a critical piece of how we take care of islanders, because everybody deserves to be taken care of. So that's my rant for today. I do one of those just about every week. It's a consistent thing. Thank you so much for your candor today. Please let us know as a committee what we can do in terms of the recommendations we can make that will move this forward. As a representative for Charlottetown, I would also sort of take that on board as something that I personally, you know, want to see happening here, and recognize my colleagues' comments about that we can't ignore the fact that we also need this in Summerside and Montague and Surrey as well.
Great.
Yeah, and thanks
Yeah,
again.
perfect. Great.
Mike, sorry, I feel like I haven't given you the time today about, from your perspective.
Just say that it's a priority for us too, and that's really with the governance part, that we want to make sure that this is a success. I've been involved with many projects and organizations where we kind of worked off the corner of our desk, and you know, sometimes it falls off the corner, and this is way too important for that to happen. You know, I've been dealing with this for almost 20 years, and the group of people that we have around the table are very passionate about helping people. And, you know, there are lots of challenges, but we're, like, I don't want to use this as a crutch, but we're only about 9 months in.
Yeah.
And, you know, we have a lot of work to do, and I think that, you know, as a group, we're up to that challenge, and there are certainly important steps that we need to take.
Excellent. This is a great presentation, and I'll ask you this now, and it's just to make sure that we have it straight. If there was one or two or three things that we could put in our report as a committee that would assist the work that you're doing, and if you want to get back to us on those, or you could answer them now, what would those two or three things be?
I think, to reiterate, would be the location and the funding going forward is something that is really critical to us being able to deliver this service going forward, and not relying on, applying for grants last minute to cover deficit.
Great, excellent. I think that's good as the committee's. Oh, Mike, sorry.
If I could just add that for the organization, that's extremely important. But the individuals that we see every day, you know, there are challenges that they have, housing being one, but addictions and mental health are major things in their lives that they deal with every day. So I don't think that's any secret, but you know, those are major things that they deal with every day that have to be tackled.
Excellent, perfect. Excellent presentation, and we'll leave it there. We'll call it for now, and committee will keep you in mind, and we will hopefully bring you in sometime in the next year to see how you're doing and if there's anything else we could do. So we'll take a short 2-minute recess just to clear our guests, and then we'll come back and conclude our meeting. We're back to move on to number 4, which is review of correspondence. So I'll pass it over to our clerk to.
Yes. So the Juvenile Diabetes Research Foundation, they were on the work plan, but COVID-related matters had taken priority. Brooks Roach had reached out on behalf of them after the Yukon government fully funded insulin pumps and continuous glucose monitors. So he's recommending that PEI follow suit. He knows the committee's plate is full, so he sent along his presentation for the committee's consideration, so I'll make sure that all the members get that, but I just wanted to touch base, and I know that the report will probably be more on the COVID end, but you'll have the information if you want to consider that.
Perfect. Yeah, great. Any dialogue there? That's okay? So, and we will try to get him. Well, we'll work on a work plan, but I think it's probably important to all committee members.
And again,
Sure,
after the House sits, when
Perfect.
the committee refocuses, yeah.
Excellent. Perfect. And that's it for correspondence? Great. So number 5, new business this time. Anybody have any new business? No? Great. Excellent. Can I get a motion to adjourn? Anybody? Brad, Sunny, and Hannah, all of us. Meeting is adjourned.